So this video is going to focus on the vertebral column and the different sections of the vertebra and the parts of a vertebra. I have several other videos here on YouTube. There's a video on basically the formation of bone and ossification. I have a video that talks about the 4 different categories of bones, like a long bone, a short bone. There's a video that talks about prostheses and depressions. And then I have 2 videos on the bones of the skull. I also have one that talks about your rib cage and your sternum. You have 206 bones of your body, and the vertebral column here is going to just look at your vertebra themselves. Your vertebral column is often called your spine, and that's due to this sharp projection that sticks off the back of it. And you can actually use that projection to classify your vertebra. If you were just to be handed a bucket of vertebra, you could use that sharp projection to divide them into 3 different groups. But in the case of your vertebral column, as you can see on this picture, most of your vertebrae don't have a name. They're just divided into groups. And the major groups are your cervical vertebra, which is basically the vertebra of your neck, and they are C1 through C7. You have your thoracic vertebra, which are the ones of your chest. They're the ones that form your rib cage. They're T1 through T12. You have your lumbar vertebra, which are the vertebra of your lower back. They're L1 through L5. And then you have your sacrum, which is commonly called your butt bone. It's actually 5 bones that have fused together. And then you have your coccyx, which is what's commonly called your tailbone. It's vestigial in humans. You had a tail as an embryo, but it was incorporated into your body. And it really has no purpose for us anymore. So on average, your coccyx bone is about 4 vertebrae, very small vertebrae that have fused together, but that number can vary from person to person. And since we are bipedal, or some people say bipedal, we do stand upright, our spine has to withstand a lot of weight. So when we talk about joints, a joint is any place 2 bones come together. And where we have joints, we have cartilage in between them. And usually in a joint such as a hinge joint, which is your elbow, or a ball and socket joint, which is like your shoulders or your hips, the type of cartilage that we find there is a very smooth, greasy cartilage called hyaline cartilage. But in the case of your vertebra, this is made from the cartilage in between your bones is made from what's called fibrocartilage. Fibrocartilage is a very strong cartilage. It's one of the strongest cartilages we have. And it gets its name because of all the collagen fibers that are in it. And we tend to call this piece of cartilage your intervertebral disc. So when people talk about having a slipped disc, this piece of cartilage has gotten loose and has slid to the side. And that can cause the vertebra to tilt, and it can pinch this cartilage. If it's pushed backwards, it can push up against the nerve and cause what's called a pinched nerve. But in the case of intravertebral disc, they are a lot, I can compare them to what's like a jelly donut. And it's got this woven, thick cartilage donut to it. And then it's got a goo on the inside. And the goo on the inside is commonly called the nucleus pulposus. Nucleus letting you know it's in the center, pulposus letting you know it's a goo. And the woven sac of cartilage is called the annulus fibrosus. Annulus letting you know that it's a circle, it's round, it's like a sac. And fibrosus lets you know that it is made from these collagen fibers. But as we go down our body, we get heavier. So you're going to see our vertebra get larger as we go down, and the vertebra get thicker and stronger as you go down, and the disc in between them also gets thicker as you go down. And so when we talk about your vertebral column, you do have what we call normal curvature, which we're going to talk about here in a second. And again, of all the vertebrae in your body, only 2 of them really have a name. So we do have 206 bones in the body. And there's a lot of bones in your vertebra. As you can see here, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbars, 1 sacrum, and 1 coccyx. And so when we're talking about the 206 bones of the body, you don't have to name all the vertebrae. They don't all have separate names. They're just classified according to their groups. Now, the first 2 vertebrae that we have in our body do have names. And we're going to talk about those later on. They're called the atlas and the axis, but they're the only 2 vertebrae that have their own names. So what we're going to look at first is what we call vertebral alignment. And the picture on the left shows what the vertebra should look like if you're looking at the side of somebody, and the picture on the right shows you what your vertebra should look like if you're looking at the back of somebody. In a perfect world, our vertebra would be straight up and down. And you'll notice that they have wings that come off the sides. You're going to see later that these wings are called transverse processes. A process is something that sticks off a bone, and transverse means across. So it kind of forms these wings across the bone. And this is where your back muscles attach. And in a perfect world, the back muscles on the left would be the same length and same strength as the back muscles on the right. So therefore, in a perfect world, our backbone would be perfectly straight up and down, like you see in this picture, letter B. However, we know the world is not perfect, and we know that our muscles are not equal length and they're not equal strength. So therefore, 99% of us, our backbone, our spinal column, our vertebral column is not perfectly straight. It tends to have a small shift to it. Because if muscles on one side are shorter than the other, they're going to pull the bone to that side. So our body tends to compensate. If bones get pulled to the left at the top, then down at the bottom, the bones will get pulled to the right in order to compensate. So in all honesty, almost nobody has perfect straight up and down alignment. The picture on the left, picture A, is showing what you should look like from the side. Now, it's kind of hard to see, but we have what's called the cervical curvature. Those are the bones of your neck. The thoracic curvature are what you would call your rib cage bones. And then your lumbar curvature is your lower back. Well, in a person, the cervical curvature is about where your shoulders are, and the lumbar curvature is about where your hips are. And they should be directly lined up. So if you were standing in front of me and I took a string or a meter stick and I put it on your shoulder and let it hang down, your shoulder should directly line up with your hips. And again, not everybody's perfect, so this doesn't always happen, but this is what we're talking about when we discuss spinal alignment. So, like I said, just the way that our muscles are set up, nobody has perfect alignment. So let's take a look at some of these imperfections. Now, scoliosis is one that you have all heard of, and you can see this nice fancy definition. It's called abnormal curvature of the spine. Scoliosis is often called left to right curvature, and this is going back to that picture B, where if you look at somebody's back, their spine, their vertebral column should be straight up and down. Well, nobody has a perfect straight up and down. Everybody's backbone has a little bit of S-shaped curvature to it. So like I said, it's going to compensate. If your bones are pulled a little bit to the left on the top, they're going to compensate and kind of balance out by pulling a little bit to the right on the bottom. So everybody has some type, like I said, 99%, almost nobody has a straight up and down vertebral column. We all have a little bit left to right curvature, but that doesn't make it scoliosis. To have scoliosis, the doctors have very precise measurements. They have angles. As long as your spine fits into this certain spot, then you're not considered to have scoliosis. You just have normal curvature of your spine. But when it really gets out of whack or pulled to one side or the other, as you see in this picture, at that point in time, you are considered to have scoliosis. And again, there's very precise angles that they look for. But with scoliosis, you can see that there's kind of a twisting. Notice one shoulder will be higher than the other. And notice if the hips are also going to be unaligned. And scoliosis can lead to people walking with a limp. It can lead to their leg bones not forming correctly. One leg bone maybe being a little longer than the other or pushed down a little bit more just from the way that the hips are shaped. I personally have scoliosis. For those of you who know me, one of my shoulders is higher than the other, and I tend to walk in high heels because that allows me to change my center of gravity and reposition my hips. So for those people who know me, if they ever see me in flat shoes, when I try to stand up, one of my legs, I hold a little bit differently until I get my balance, and then I can put my foot down. But everybody has a mild twist or curvature. Almost nobody has a perfect straight up and down, but it's not considered scoliosis until you hit these angles. And scoliosis is what's called left to right curvature. Now that's different from what's called kyphosis or lordosis. In the case of kyphosis for years is what was called hunchback. And this goes along with the picture A, where you're looking at somebody from the side. Like I mentioned, if you take a ruler and you put it on a person's shoulder and just let it hang, it should directly line up with the hips. Well, in the case of people with kyphosis, they have an abnormal curvature near their shoulders, and it kind of pushes their head forward. So their head would be in the front, and their hips would kind of be in the back. So very similar to what you're seeing right here, okay? And this is an actual photo of a student who has what was commonly called hunchback. But if you'll notice in this picture here, this is kyphosis, okay? You can see how there's this huge malalignment of their spinal cord, which causes this huge hunch. And so notice their head tends to be thrown forward, okay? And as you get older, as you bend over, you can notice that this is even more pronounced. A lot of times with people with kyphosis, again, I had a student who had this. They had to go in over various times of his life, and they took a metal rod and they positioned it on his spine, and they kind of fused his spine in order to help him stand up straight. And when he was a senior in high school, he went back for his last surgery. And before he left, when he would look at you, it was he was hunched over and he had to kind of tilt his head back to look up. But when he came back to school, I'm 5'10". When he came back to school, he was standing even taller than I was. They were able to almost perfectly straighten out his spine by this time and give him almost that perfect alignment, that up and down alignment. But in the case of kyphosis, which is the first figure you have here, you can see how the shoulder curvature is overpronounced, and that forces the head to be pushed forward. Now, the second picture here is what's called lordosis. Okay? With scoliosis, you're looking from a left to right. With kyphosis, your head, the shoulder region, is pushed forward. That's opposite of what's called lordosis. And lordosis is this picture here. With lordosis, you have a malformation of the curvature of your lower back. So it causes your hips to be shoved forward. And this is the formal definition. It tends to be straight. However, the curvature of the lower back. And so this is what's commonly called sway back. Okay. Again, for those of you people who know me, I have lordosis. I am sway back. My shoulders are way behind my hips. If you look at me from the side, my hips come first. Okay. Well, these are just some common spinal alignment problems that a person can have. Okay. This is basically a picture of lordosis. This person here has what we would consider perfect alignment. The shoulders line up with the hips. But here you can see how the hips are shoved forward. Okay. And it gives them, you can see this large curvature that you have right here. Okay. That's an example of what we would call lordosis. So when we talk about your vertebra, which people commonly call the spine, remember structure determines function. To be called a vertebra, you have to have certain parts. And vertebra fall into the category that we call irregular bones. So most vertebrae, when you look at them from the top, are going to have this overall shape to them and these overall features. We do have two vertebrae in our neck that are very different, and then we have fused vertebra of the sacrum and coccyx bone. But in the case of a vertebra, just some outstanding features that vertebrae have. This thick pad right here, what's called the body, that is the weight-bearing portion of the vertebra. And what we find is your vertebra up towards the neck have smaller, thinner bodies, but they get larger and thicker as you go down. That makes your vertebra stronger, and it makes your vertebra able to withstand the weight. Now, you also have this part here. This whole thing is what's called the vertebral arch, and it has several features that we need to talk about. Now, like I mentioned, when you look at the picture of the vertebra from the back, you have these wings that stick out. These are those wings, those transverse processes, and those are the ones that your back muscles attach to. All vertebrae except for one have these transverse processes, and these are those wings that we saw in that picture. Now, they do have a hole, and for those of you who know me, the foramen, we talk about holes a lot. A foramen is a hole, and it's a hole through a bone so nerves and blood vessels can pass through. So we have what's called the vertebral foramen. That's where your spinal cord passes through. And an interesting fact about your spinal cord is you have more nerves higher up than you do lower down. So your spinal cord is actually thicker up top, and it gets thinner and thinner and thinner as you go down because nerves branch off along the way. So your vertebral foramens in the top of your spinal cord or spinal formation are larger than the vertebral foramens as you go down. And by the time we reach the end of our spinal cord, it's called the terminal filament, it doesn't have any nervous tissue in it at all because we do not use our coccyx bones. We don't have tails. Now, also in another video, we talked about these things called condyles. And condyles are smooth areas such as this one here and this one here, where the bones rest up against each other. They tend to be covered with hyaline cartilage, and this is where a joint is going to form. Well, on the case of our transverse processes, you can see that there is a condyle right here. Okay? This just happens to be an example of a thoracic vertebra, and I know that because your thoracic vertebra have these condyles on your transverse processes, and they're some of the only ones that do because that's where your ribs articulate. Your ribs will articulate with your thoracic. You have 12 pairs of ribs, you have 12 thoracic vertebrae. Okay. They also have what are called the articular processes. Okay. These are also condyles, and this is where, as they stack on top of each other, they kind of rest in place. And the spine gets its name because of this sharp projection it has in the back. That's called the spinous process. And you can actually identify different types of vertebra based on the spinous process out the back. So we're going to look at these different types of vertebra. The first 7 vertebrae you have are called your cervical vertebra. They're the vertebrae that make up your neck. And like I said, most of your vertebrae do not have a specific name with the exception of the first 2 vertebrae you have. And that's what these pictures are. You have the atlas and you have the axis. The very first vertebra you have, cervical vertebra number 1, is also called the atlas. It has a shape that no other vertebra have. And it gets its name from the mythology gentleman, or the story of Atlas who held the world on his shoulders. Well, here are the shoulders. We have a shoulder here, and we have a shoulder here. And the world that this Atlas is holding is your skull. So if you look back at my videos on the skull, the cranial bones of the skull, we have what's called the occipital bone, which makes up a lot of the bottom of our skull. And the occipital bone had 2 condyles called the occipital condyles, and they were covered with hyaline cartilage. Well, the occipital condyles would sit right here on top of the articular facets. Okay? They're also called articular processes. They're also called articular condyles. This is where basically they stack on top of each other. So this guy has a body unlike other vertebral bodies, which you're going to see. Here's the vertebral foramen. That's that large hole that your spinal cord is going to pass through. And then here are the transverse processes, the wings on the side. Now, vertebra number 2 is called the axis. And the axis, when you think the term axis, you think the term to turn. And your axis is special because it has this point that sticks up called the odontoid or the dens process. Odontoid or dens are both referring to a tooth. It looks like a tooth sticking up off of a jaw. Okay. This is a pivot point. So the atlas is holding your skull, and it sits on top of the axis, and they pivot together. And my next slide, you're going to see how this works. But I also wanted to show you how, in the case of spine number 1, or cervical vertebra number 1, it doesn't have a spine. It doesn't have a sharp point coming off of it. That's because your skull tilts backwards, and so there's no need to have one. But in the case of the spinous process of the axis, this is a closer picture of it, you can see it forks. And this is what's called the transverse, or the bifid process, bi meaning 2. It forks into 2 parts. So here you can see how the atlas, which is on top, sits on the axis, and how the dens or the Odonti process. Okay. So this would be an articular facet here. This is where the skull would be resting. Here's the spine, or excuse me, here's the transverse process, the wings that stick out the side. Now, your cervical vertebrae are special because they have an extra opening in them. They have an opening that none of your other vertebrae have, and that opening is called your transverse foramen. The transverse foramen is where the vertebral artery and vertebral veins pass through on their way up to the brain, and these are the only vertebrae that have these extra openings. None of the other sets of vertebrae have them. So the cervical vertebrae, again, are the ones that make up the bones of your neck. And you have 7 of them, C1 through C7. C1 is also called the atlas. C2 is also called the axis. Now this is a lateral view, which means it's from the side. But I wanted you to see this view because you can look at the spines of vertebra and be able to group them into their groups. In the case of number 3 here, this is the spine. And this is an example of a cervical vertebra. And your cervical vertebra spine sticks straight out. And this is because our ancestors, if we were predators and, our furry relatives that walk on our fours, these guys would stick straight up like a porcupine. So any predator going after their neck, they would hit these sharp projections and hopefully let go. But also in this picture, you can see number 5. Number 5 is the transverse foramen, that extra hole. Number 1 represents the vertebral foramen that the spinal cord passes through. Number 7 represents the body, that's the weight-bearing pad. And number 2 represents one of those articular facets, where this joint's going to form where our bones stack on top of each other. This is an example of a thoracic vertebra. Your thoracic vertebra are the vertebrae that make up your rib cage. You have 12 pairs of ribs, you have 12 thoracic vertebrae. So each thoracic vertebra has 2 ribs articulate with them, and that means forms a joint. And our ribs articulate with the transverse processes. And again, we have what's called a costal facet. It's an example of a fossa. It is a condyle, and this is where your ribs would articulate with. Well, I can't say join, but this is where the ribs come in contact with the thoracic vertebra to form your rib cage. And so you can see on here, it's what's called the costal facet. And the transverse processes are the wings that stick off the side. In the case of, you can see the body, how it is getting thicker because we're starting to weigh more as we go down. And in the case of thoracic vertebra, the spinous process points downward. This is a telltale sign. Okay? And the reason for this is when we feel threatened, we curl up. We take our arms and we bring them in front of our body, and that helps protect our heart and lungs, and we get in kind of like this fighting stance. Well, when we do that, this whole picture tilts. So it'd be like you taking your computer and turning it counterclockwise this way. And this guy right here would stick straight up like a porcupine. And again, that's to help protect you. But in the case of cervical vertebra, the spine sticks straight out. In the case of thoracic vertebra, it tilts downward. Which then leads us to lumbar vertebra, which is what we're looking at here. Now, up here at the top, this is just your classic example. You can see that this guy right here would be your spine. This, they actually drew a little bit of cartilage on there. That would be hyaline cartilage to show you that that's a joint. This would be an articular facet. This is where the 2 spines kind of come together like pieces of a puzzle. This right here would be our transverse process. This is our vertebral foramen. And this right here is our body. Now down here at the bottom, this is a side view, and it is a classic example of a lumbar vertebra, which is some of the thickest vertebrae we have. They're in our lower back. In the case of the lumbar vertebra, they have a very thick spine, and it kind of forms what looks like a fishtail. It's not sharp and pointy, it's just really thick and kind of blunt. So this line right here would represent your transverse process, your articular facet. This line here would be your transverse process. Here's another articular facet, and it's showing the condyle with the cartilage on it. This is the body, the thick part, as you go down. You have 7 cervical vertebrae, C1 through C7. Number 1 and number 2, the atlas and the axis, are the only ones that have the name. You have 12 thoracic vertebrae, T1 through T12. And you have 5 lumbar vertebrae, L1 through L5.